Hi, my name is Cynthia. I'm an occupational therapist with over 25 years of experience. I have decided to create a series of videos to help everyone out there learn some tips and tricks that they can use in their everyday life to improve their health and wellness. Today, I would like to talk to you a little bit about a problem called trigger finger. Trigger finger occurs when the sheath that is around the tendons in your hand become inflamed, causing it difficult to straighten your fingers out. That tendon does not want to slide back open like it should, and then the affected fingers will stay down and you have to really force it open and it may snap up. Or if it is severe enough, it may not even open on its own with force, and you have to use your other hand to force it open. This can be a very, very painful problem, and the more times your finger locks, the worse it's going to get. So what can you do about it? To start with, you want to avoid tight grasps. You want to avoid repetitive grasps. So if you have to use a lot of utensils and or tools in your day-to-day life, try using tools with larger handles so you can use a looser grasp to try to avoid that locking. You can try wearing gloves, like golfer gloves or weightlifter gloves that are fingerless, that have some padding and maybe some anti-slip on them that will help you to use a looser grasp. If you have stiffness in your fingers as a result of the trigger finger, you can do some little stretching exercises. You just want to be careful that you are doing just one or two joints at a time in your fingers, not all three joints at the same time, because that is when your fingers will lock. What I'm doing right now is just bending and straightening two joints in my fingers, not all three. So like here, I'm doing just one joint, the big knuckles by themselves, which will not cause that locking to occur. What are some of the other things that you can do? You can try using cold packs. You can use ibuprofen, which is anti-inflammatory as well as pain relieving. If by avoiding tight grasps, avoiding the locking, and using anti-inflammatory medications does not help improve the problem, you may have a severe enough case that you will need to seek professional help. You may need to see your physician, do some occupational therapy, may require a cortisone injection, or possibly even surgery if it in severe enough cases. So I hope you found this little bit of information helpful. If you know somebody who has trigger finger, please share this with them. Be sure to subscribe, and I look forward to creating more helpful videos for you all. Thanks. Bye.